Hello, viewers. I welcome you to at the Okoromi channel. Today, we are having someone in our midst who has been with us before to talk about the coronavirus, especially talking about the misconception about the coronavirus. It's no other person than Doctor Ini Ekong. You're welcome.
Thank you very much.
Yeah,
My
the,
pleasure to be here.
the last time we thought you explained extensively about the coronavirus and the many misconceptions that people have about the virus. We all know
Yeah.
now, based on events that are happening all over the world, we have now come to realize that coronavirus is real and it has come to stay with us. With,
Yeah.
mm, with the incident happening in places like India, Brazil, Americans, and all these other parts of the world. But today, I would like to question you on some other things, especially the variants. What
Okay.
is the variant? What is it all about? What because we hear of different variants now today. We hear Indian variant. We hear what is the variant really all about?
Okay. Thank you very much. So, basically, as this virus is being transmitted from person to person,
Okay.
it keeps on replicating and making copies of itself.
Okay.
Sometimes there might be some changes in the copies. Just look at it like a factory, maybe that is producing something.
Okay.
Sometimes you see factory error inputs. Once you are mass producing something, there will most likely be some changes as those things are being produced.
Okay.
So that factory error inputs is what is regarded as mutation. Those changes within the copies.
Okay.
So a virus with one or more new mutation is referred to as a variant of the original virus.
Okay. Okay.
Yeah. So most of the mutations are of no serious consequence, but sometimes this mutation also gives advantage to the new strain of the virus.
Okay.
Like it's been observed that some of the new variants tend to show that the virus has a better capacity to spread more easily,
Okay.
or sometimes to even make people more sick,
Okay.
or to make it more resistant to treatment.
Okay.
Like that has been reported during this COVID pandemic.
Okay.
So basically, that's what a variant is all about.
Okay. So how are the variants? How are they classified? From what you said now, so how do we classify the variants?
Okay, so basically, there are three major classifications of variants.
Okay.
One is the variant of interest,
Okay.
or variant of concern, and the last one, variant of high consequence.
Okay.
So this represents the different maturity level,
Okay.
or potential maturity level of the COVID or other viral variants. So, for instance, the variant of interest, in that one shows that there's a presence of certain factors associated with potential disease transmission, or that can affect the diagnostics or the immune response
Okay.
or treatment. So this one shows there are some what we call genetic markers. Some of the just that potential, if they have those genetic markers
Okay.
that tend to make them potentially more transmissive or resistant to treatment or evade immune response. Those ones are called variants of interest. It's just potential, but it's not actually documented.
Okay.
So, but that's where you have quite a number of the variants, that we currently have now as variants of interest.
Okay.
But once they begin to show evidence that beyond that potential now, there's evidence that there's increased rate of transmission, or there's more severe disease, or there's a reduction in susceptibility to either antibodies, vaccines, or treatments, or in some cases even diagnosis, then they have been regarded as variants of concern.
Okay.
So so you have a number of variants right now, because the WHO, the CDC, and other responsible agencies are constantly monitoring these variants.
Okay.
So many countries are sequencing the variants and then document them. So there's a world body, WHO or CDC, coordinating all these variants. So sometimes you see some variants. That's why the history, the generation of variants can be traced. I think maybe when we talk about the types of variants, you'll be able to understand that. So for variants of concern, when there's evidence of all these factors,
Okay.
then there's a variant of high consequence. There's a variant of high consequence. In this one, there is clear evidence. The first variant of interest, you said there's that potential.
Yeah.
In variant of concern, there's evidence.
Okay.
But in the variant of high consequence, there is clear evidence that there is total failure of diagnostics. Sometimes you can't diagnose it, or even significant reduction in vaccine effectiveness, or severe clinical disease, increased transmission, and all that.
Oh.
So those ones are the ones that are regarded as variant of high consequence. But luckily, presently, there's no reported, variant of high consequence at the moment.
Okay.
But there are a lot of variants of interest with that potential, and then a few of them have also demonstrated evidence of the increased transmission or severe disease, or evading treatment or vaccination.
Okay. Wow. That's very, very clear one there. So what are the examples of some of these common variants then, if that's the case?
Okay, so there are a few common, there are quite a lot of variants that have been isolated,
Okay.
or sequenced all over the world.
Okay.
But like we said before, most of them, those changes, are not, have no consequence.
Okay.
All right, some of them is just copy factory error, but it doesn't really have a deleterious consequence on human transmission. But there are few that have been quite significantly been studied and have shown some of the different characteristics of the other variant of interest or concern that we just described. So we have they are being classified in strains or lineages.
Okay.
So you have the lineage B1351 identified in South Africa.
Okay.
This one clearly shows evidence of increased transmissibility. The transmission is faster, and then there are possible adverse illnesses in young and healthy individuals.
Okay.
So like initially, the COVID, the impact was less in the younger people, but this lineage in South Africa has shown not just the fact that it can transmit faster, but it also affects more of the younger and the healthy people. There is another very common, I think it's one of the most widely spread variant, is the one identified in the UK, which is of the lineage B117. It was a lot of demonstrated outbreaks around London and the Kent area and some other UK counties. This one showed fourfold increase in the cases just within a period of 10 weeks.
Wow.
It did times 4 when compared to the periods before which this variant was isolated. It showed that the rate of infection increased more than 4 times, and that was just within 10 weeks, So, in fact, when compared to the other variants, it's shown to be 70% more transmissible than other strains and keeps on changing to even more other variants. And then also there's a variant that is commonly associated with Brazil. That's of the lineage P1.
Okay.
That one also actually was identified in travelers from Brazil to Japan. Okay. And then that period where it was first sequenced coincided with a period of resurgence of infections, rapid increase of the number of hospitalized cases just around January, and as well as reinfection,
okay,
was also shown to be associated with this lineage. So, apart beyond the high transmission, there's also evidence that this has the potential to escape the immune system. A lot of studies are still going on. And of course, if it escapes the immune system, there is likelihood that the vaccine efficacy for this lineage might be significantly reduced.
Okay.
So then the other one variant that I would like to talk about is the one that is identified in India. I'm sure we know what has been happening in India in the last few months.
A very high risk area.
Yeah. So that has also been associated to that high transmission or high rates of increase in the cases detected has been associated with a COVID variant of the lineage B1617. That was actually first detected in the U.S. between late February and March of this year.
Okay.
And this one even shows that it's more remember we said the transmission rates of the UK variant is 70% more than other strains.
Yeah.
But this Indian variant has shown to be even more transmissible than that. So that's why you see we saw so many reported cases within a short period in India, and also the mortality that was associated with it. So in the nutshell, those are the most common examples of the variants around the world. Even though there are so many thousands of other variants that have been isolated, but most of them are mainly variants of interest. They've not really shown any significant interference with some of the dynamics of the COVID transmission.
So, sir, with all this explanation now about the examples of the common variant now, so which one do you think is more transmissible, as the case may be, that we should be more careful about, especially in our country here?
I think from the report so far, even though this a lot of research is still being conducted around all the variants. So presently, every sample that is taken to the lab for diagnosis in some way has been the viruses are isolated. They are being sequenced to know what genome they belong to, so as to see, and there's a lot of communication between most parts of the world in terms of the response to see the generation or the historical trend of this vaccine, to see if there are some relationship. So, but for now, it looks like the Indian variant to me, with some of the studies that have come to the public domain, it looks like the Indian variant is very, very transmissible, more transmissible than all the other identified variants. And it's already been, it's already been isolated in Nigeria.
Wow.
And even in 6 other African countries.
Wow.
So, and it shows you how this virus travels from country to country, from continent to continent, within a very short period of time.
Wow, that's a very big one. Oh. So from what we've been hearing so far, we've at least so many persons have been taking vaccine against the virus. So the vaccine available now, does it work against the Indian variant, or what do you have to say?
Okay, so now, but India, luckily, there's a new study now that has shown that the Pfizer BioNTech vaccine and even the AstraZeneca that we commonly using in Nigeria now, the 2 doses are actually effective against the Indian variant. So that's a very good news. Like I said, studies are still ongoing, but for now there's a study that has shown that I've made that report. Even in Brazil, recently there is a study that also showed that a significant reduction in the transmission rate within some high congested areas of the Brazil, as a result of the vaccination. So there's evidence of vaccine protecting against some of these variants.
Okay, so already now from your explanation, we already have the Indian variant in Nigeria already.
Yes, it's been isolated.
So that means that the federal government should do something like because the other day I was hearing them saying that they are going to stop flight from India to Nigeria. I don't know whether that is applicable at the moment, or we still have flights coming from there.
Basically, there are specific measures that have already been enforced by government.
Okay.
In terms of if you are flying from some of those parts of the world that have some of the variants of concern, there's a mandatory quarantine being implemented just to be sure that the variant doesn't spread more than it should, or doesn't even come into the country. And a lot has been done. The government has done, has really done well in that respect.
Okay.
In beginning to right from the flights coming from India, making sure that there's a institutional quarantine, of those travelers before, within a specified period of time before they are being allowed to go into the general population.
Okay. So thank you very much, Doctor. So what impact does this new variant of the COVID-19 virus have on the vaccine?
Okay, so basically, like you said now, there are studies showing that these vaccines are still working, can still protect against the new variants.
Okay.
And to be honest, even if it doesn't, even if there's reduction in the protection, it is still enough, to make sure that people who get infected don't get as ill as they would have been. So the vaccine, however you want to look at it, is very, very important. Particularly it's just not just antibodies, but also cell type of immune response.
Okay.
So it's not just one type. Antibody can just be, building antibodies, but it also has a kind of what we call cell-mediated immunity. So, it gives like kind of double coverage. So it's very difficult for a variant to completely evade some of the vaccines that have been given now.
Okay.
And then also the mutations have not been shown to make the vaccines completely ineffective. Even when they are not as effective, there's still some level of protection that they provide.
Okay.
So, however, there's still it's not like there's still a possibility, assuming the protection, the level of effectiveness of the vaccine is slightly reduced as a result of the variant. There's still a possibility that some kind of modification in terms of the composition of the vaccine can be done, and that will give it more efficacy.
Okay.
And maybe probably booster doses can come up, and you understand. So it's all a win-win for vaccination. All the vaccines that are currently being deployed at the moment.
Okay. So what do you think now can be done to prevent further viral mutation based on your explanation now?
So basically, the first thing to prevent these variants or mutations of the virus is to stop the spread of it. Remember, the more it replicates, the more it reproduces, the more it makes copies, the more it changes and brings up new variants.
Okay.
So the first and best way to stop new variants emanating is to stop the spread, and that is to adopt all the measures that have been currently being highlighted for reduction in transmission, like the frequent hand washing, wearing of face masks, physical distancing,
sanitizing the hand,
and of course, so those preventive
measures. Okay.
measures first, So, and of course, rolling out of the vaccination as quickly as possible, because remember, these variants, some of them actually have more effects on those with high risk. That is those who are elderly or who have comorbidities. So the faster we roll out this vaccine, the better for the population in terms of reduction of the mutation, and the more likely it will protect those with the high risk. So if there are new variants, those who don't have high risk, new variants might not really have significant effect on them. But those who are already high risk, they have hypertension or diabetes or any form of immune deficiency, or are aged, they are more likely to be susceptible to the newer COVID variant. So that means that we need to scale up the rate of vaccination to make sure that to not allow the virus opportunity to replicate, and that is true, and also in combination with also not just to relax. We have vaccines, so we no longer take precautionary measures like hand washing, wearing face masks, and physical distancing. So it's a combination of all these that will help to reduce the rate of, mutation in the viral transmission. So also there are a couple of other things that can also be done in terms of during the development of these vaccines. There are opportunities to incorporate more than one strain of the virus into the vaccine to give it a broader, protection against the viruses. And there might be need for booster doses. Some people have also recommended booster shots
Okay.
That it might be to reinforce the efficacy, in future. And then also, um, yeah, of course, I talked about scaling up vaccine manufacture and rollout. Then also, yeah, we're prioritizing vaccinating people of high risk first, and then ensuring that there's equitable access to the vaccine.
Okay.
You know that some of the rate of vaccination is really low in the third world. So ensure vaccine equity will allow these areas to scale up their vaccination and reduce the rate of the virus circulation as well as formation of new variants.
Okay. So from your explanation now, it means we've got a lot to do to ensure that to prevent the further spread and the mutation of the virus. We have got a lot to do. So now I would like you to sum it up now. There are still some people out there who still have, based on some beliefs known to them, that they don't feel like taking the vaccine. So what do you feel? What do you think it should be? What advice do you have for such people?
My advice is just in one sentence would be knowledge is power.
Okay.
Knowledge is power. If you are well informed, then you have the capacity to promote your health and take good care of yourself.
Okay.
So, not just seeking for information and information from the right source is very critical, in developing attitudes towards acceptance or rejection of vaccination. Like we've been discussing in the past few minutes, it is very, very critical that everyone should receive the vaccine.
Okay.
If we need our world to go back to close to what we had before, then everybody needs to get themselves vaccinated. I remember when amongst even some of the people that knew me, and they were like, Doctor, I want you to take the vaccine, then we'll observe you for months, and if you are still normal, then we'll go and take our ass. And I've taken it now for months, and I keep on telling people, I'm still here, nothing happened to me, even after taking the vaccine. So a lot of people have gone to take, a lot of people who were waiting, have also gone to take theirs. So my advice is, everybody, the government has made this vaccine available free of charge, and it's very, very easy. It's not painful. It doesn't have, there's no serious side effects other than maybe.
Sorry for cutting you, Doctor, but that's one of the things that people are scared of, the side effects. Some of them talk about the side effects and all this.
So of course, there's always side effects, but sometimes you look at the risk benefit, proportion. So you want to see what is the risk of not even taking the vaccine and then probably getting the virus with all these new variants that we're talking about, and you don't know which one you might come in contact, and you might be more sick, or even sometimes it might result in death or so. So when compared to just a simple side effect of maybe just a little pain,
or a few minutes of maybe headache or something.
Yeah. So because from the people who are vaccinated, was not really the commonest, reported side effect is just, and it's not at that point because the needle is so tiny that you won't even feel any pain when you are receiving it. But maybe a few days later, you might just feel very tiny pain, that goes off. Okay. So these things are insignificant when you compare to the cost of getting the disease and the risk of other mortality resulting from getting the infection. So there's really not in Nigeria. We've not really seen. Yes, at some point we heard things about blood clot and all that in Europe and all that. But in Nigeria, I've not really heard about that here, and I've not seen any serious death related to the vaccination. I've not heard of it in Nigeria here. So, and all the people, all our colleagues and family and friends who have taken this vaccine, nobody even has reported any serious side effects. Other than that, might not be maybe a little headache in a very, very, very insignificant number of people. So,
thank you very much, Doctor, for always coming to our rescue, because since this virus actually came in, you have always been of help. Whenever we call you to enlighten us more, you are always there to help us out. I must confess, I've learned a lot, and I also believe that so many persons who are listening, who are going to be listening to this, they will also learn more. Thank you very much, sir.
Thank you.
And hope when we call you again for updates, you will always be there to help.
No problem. It will be my pleasure.
All right. Thank you very much.
Thank you, sir.
Have a blessed day.
Okay. Bye-bye.
Yeah.